and I've found this to be quite interesting, and I'd love to hear your take on it, is this whole craze of people saying that mouth breathing can actually have a deforming effect on your face, and that if you're, I've even heard Andrew Huberman going on about this, and there's just to give you full transparency, I've been taping my mouth and putting a nasal strip on my nose as I go to sleep lately, and I do feel more rested, but there is evidence to say that nasal breathing does lower your resting heart rate, so maybe that's probably the whole explanation there. But what do you make of this whole idea that mouth breathing can deform one's face and that we should be nasal breathing all the time? Is that true, or is it not so much?
Yeah, I don't really have I don't have a massively like passionate take on the whole mouth breathing, nose breathing thing. I think it's one of these like very minor variables that does have some physiological significance, like you say, like the resting heart rate component, but is just totally overblown. And what I would say to your specific question is, I think what's more of relevance and the reason that people make these claims with great strength is that it is true that facial morphology significantly impacts how you breathe. This is most evident in like anesthetics, for example. When you try to intubate someone, you'll measure different aspects of their face. So, for example, how much they can protrude their jaw, like their teeth, how much there's an overbite or an underbite and things like that. And this becomes very relevant because you're trying to put a tube down and it's very, very difficult. You know, if someone has like a really retracted jaw and they have that classic kind of bird face, so to speak, sorry to be derogatory to anyone who has a retracted small jaw, but there is a very clear difference in how one breathes and the access to the airway, and things like risk of sleep apnea and so on. So it's not without merit that facial morphology is important. What is with far less merit is the fact that as an adult, you can now change that by not breathing through your mouth. I think that's a huge claim that I haven't seen evidence for, and I would definitely like to see evidence for if that is the case. It doesn't seem to be the case. I think that breathing is largely autonomous and largely self-selected, and yes, there are cases where people do need to improve their ability to breathe nasally. For example, if they have like a deviated septum, in some cases that requires surgery. If they've had previous trauma to the nose, that can impact their ability to breathe through the nose. But I think the idea, generally speaking, that breathing through your mouth is going to be detrimental to any significant health or performance variable is fairly unsubstantiated. Again, as I say, that's not to say that, like in your case where you feel more rested from breathing through your nose, I'm not saying that's not true. That can absolutely happen, and I think that's great. And I actually have at least one client who I've encouraged to use nasal strips because he, struggles to breathe through his nose and he finds himself snoring a lot, and it's something that we're working on. So yeah, not a super passionate take, but I would say this is definitely an area where there is a lot of kind of overconfident BS, I would say.
It's almost akin in a way, from what I gather there, to someone saying that you can change your bicep insertions or something.
Yeah, exactly. Like do this exercise to fill in this gap in your biceps when it's kind of like anatomically determined. It's like maybe for some people that if they hold their jaw in a very rigid position instead of retracting it when they breathe, that maybe there's some change in muscularity or something. But I struggle. I think that most of this is people who have decent facial structure, so to speak, already. They say that they breathe through their nose, and then that gains traction.
Yeah, I think the anecdote for me was seeing my brother breathe through his nose. I'm like, geez, he's definitely the more handsome one of the two. So I'm like, all right, I think I got to get onto this nasal breathing hype. But yeah, so it's so funny there, where a lot of this is sort of mediating kind of the well, actually I'll get to that point in a second, but I think kind of a customary point there, I've begun training my neck as well, and I think I've seen you do a bit of neck training as well. I know we both do jiu-jitsu as well. What do you make of neck training? Do you prescribe it to clients sometimes? Is it something you're a big fan of? Is there a particular way one should train their neck in any way? What do you make of that as kind of a prescription?
Yeah, I actually quite like neck training. I'm fairly pro that, to be honest. I've done a bit of neck training myself. It's something I was actually thinking today. God, I need to be a bit more consistent with that now, to do a bit more of it. I kind of have spells where I'm consistent with it and then I stop for a few weeks, and you know how it is. So I need to be a bit more consistent with neck training, but I do think it's productive, particularly for jiu-jitsu, striking sports, rugby. I think anywhere where you're taking trauma to the head, or you're being choked out in the neck. But not even just the choking, to be honest. What I think of more so when it comes to neck training and jiu-jitsu is that you end up in so many awkward positions on your neck that having extra muscle is likely to be protective against injury. And I think that's something that's important. Again, this is probably one of those areas, like I classify my views as kind of being like, right, I can say this with certainty because there's, or not almost certainty, let's say, because there's loads of evidence to support it and great long-term trials and everything. These things, when it comes to training, specifically for niche things like neck training, you're not going to get great studies on that. Okay, so I can't say like, that there's a clear reduction in injury risk, but there's enough kind of rationale and at least some hints from research that it's probably wise. So yeah, I support neck training. Just on the breathing note as well, this is something that is important, is that with things like sleep apnea risk and snoring and so on, the thicker your neck, the higher your risk of those things. So this is something you particularly see in bodybuilders that have large traps, and bodybuilders who particularly take anabolic steroids, because all tissues grow when you take steroids. So all these things can increase your risk of things like sleep apnea, because sleep apnea is largely a mechanical issue because you're lying down, you've got all this muscle that's pushing in, and then you've got this mass that stops you from being able to breathe properly. So that is something to note. Now, with that said, I don't think you're going to push yourself to sleep apnea because of a few neck bridges. It's not going to be a massive training effect. But how do I recommend training it? Did you want to come in there?
I'd love to hear about that.
So how you train it. I view the neck as kind of similar to many other areas of the body, in that, right, it has muscles. What do you need to do? You need to put tension on those muscles. How are you going to do that? You're going to load those muscles through the largest range of motion you can, safely, of course. So you've got a few different movements in the neck that are the primary things that you would train, which is flexion, chin down, extension, chin back. Then you've got lateral flexion to each side, so shoulder to or ear to shoulder, and then you've got rotation, which is saying no. So all those things can be trained, and an easy way to do it is to start with something like a neck harness. If you have access to one, I think they're fantastic because it stops you having to fiddle around with bands. And I've had a few times with bands where it's come off the anchor point and hit me in the face. It happens, but banded setups can work well if you only have bands. You can train neck extension, neck flexion. What I recommend is that when people put the band around their head, you hold it with your hands as well, and then it keeps it in place. So that can work quite well. Again, just using your kind of standard training principles, somewhere between 10 to 20 reps to start off with, specifically because when you're using a band, you're not going to do like 3 RM or anything, So 10 to 20 reps, nice, slow controlled movements. Start off with just a couple of sets because you don't want like severe neck DOMs or delayed onset muscle soreness. And then you build up from there and progressively overload over time. You can do that with all of those movements then. The neck harness works really well because you can begin to go much heavier than with bands. Like even if you have really strong bands, I'm just not taking that risk of the band coming back and taking my eye out. It has happened, people.